Sakshi sent us one article of hers regarding Ozempic. I always like the writers that take their readers into account. They should always have empathy for their readers. Your readers should relate to and understand what are you trying to say. It's never about the vocabulary. Like a good writer will seek to clarify and not to confuse. I think that is so it's not about the English at all.
Actually, I'm interested in studying Ozempic. It's a topic of interest for me. So, is there any platform that we could discuss this Ozempic drug and have some literature about it and do some research work on this?
Yes, Sakshi's letter is about that. So I would definitely encourage you to ask her what she is doing and where she plans to publish, if at all.
So, how to contact her?
Sakshi?
So we have
Is there
made our WhatsApp group. The link is in the comment box. So you can join that WhatsApp group where all of us will be there along with Manini, Sakshi, and everyone, where you can put forward your ideas, and also if you have any doubts, you can ask and you can send your drafts, etc.
My letter to editor is about semaglutide, which is the main content of Ozempic. As of now, in India, there are no guidelines for prescription for Ozempic in case of obesity in non-diabetic patients. But it is highly promoted on social media, and there are chances that people will misuse it without prescription. And this drug, which is originally an anti-diabetic, it has many adverse effects. One of them is pancreatitis. So, if a person is at a high risk and if they are taking it off label, they can develop severe adverse effects like pancreatitis, and there are cases of alopecia as well. That was the whole point of writing this letter and requesting CDSCO to make guidelines for prescription of this drug for those who don't have diabetes but want management for their obesity.
Yes, so weight loss is the biggest drug this is the biggest off-label use of Ozempic that we have seen. And Ozempic, as Sakshi correctly pointed out, especially in the cosmetic industry, the beauty industry, we see a lot of people using it for weight loss. And that is definitely not one of the uses that, and as she correctly said, she's appealing to CDC or FDA for setting up the correct guidelines for usage.
Sure, I'll read it.
Yeah.
Semaglutide, a GLP-1 receptor agonist, was initially used as an anti-diabetic medication, but has since gained popularity after receiving FDA approval for weight loss. For the treatment of diabetes, it is known to work by increasing insulin and decreasing glucagon release from the pancreas. And for the management of weight, it acts on the hypothalamus to decrease hunger and increase satiety. Plus, it can delay gastric emptying. Currently, semaglutide is marketed for weight loss under several brand names besides Ozempic. As of August 2025, the official website of Central Drugs Standard Control Organization does not approve prescribing guidelines for GLP-1 receptor agonist for obesity in non-diabetic patients. Meanwhile, there is a rising demand for semaglutide-based therapies such as the oral research and the injectable obesity-specific Ozempic and Wegovy. The prevalence of self-medication is already high in India. Without official guidelines, India is vulnerable to unmonitored use, dosage error, and falsified medications, especially as these drugs are increasingly promoted on social media platforms. With the increasing obesity rates and the absence of proper guidelines, the risk of off label use of semaglutide based therapies heightens in India, making them vulnerable not only to serious adverse GI events such as pancreatitis, but also scarcity of these drugs for diabetic patients, which has been reported internationally. Despite the popularity of GLP-1 receptor agonists, no Indian clinical trials or safety surveillance data currently exist on their use in non-diabetic populations, creating a significant pharmacovigilance blind spot. Moreover, in 2024, WHO raised concerns over supply of falsified batches of Ozempic, which can be contaminated with harmful substances. we urge CDSCO to release evidence-based prescribing guidelines for GLP-1 receptor agonist use in obesity among non-diabetic patients, mandate monitoring procedures for adverse events and practical results, launching campaigns to educate the public about the dangers of cosmetic and off-label use, supporting studies on the long-term safety, effectiveness, and affordability of GLP-1 receptor agonists that are conducted specifically in India. Parallel initiatives should include strengthening pharmacovigilance system, commissioning safety and cost effectiveness studies in Indian non-diabetic populations, and teaching patients that lifestyle modification is the primary method of managing weight without using off-label medications.